everyone. I am Sanjana, Onco nutritionist from ZenOnco.io. Today we shall be speaking about nutritional intervention for the patients who have prostate cancer. Prostate cancer will begin in the cells of the prostate glands when they start to grow out of control. Prostate gland is an important gland which is found in males. Nowadays, there are various treatment options which are present for the cancer patients who have prostate cancer. So the doctor will, yes, obviously will be deciding upon which treatment is beneficial for them. It could either be a surgery, it could be even a radiation therapy or chemotherapy as well. Now, for prostate cancer, the most important tumor marker which is generally assessed is the PSA levels in the body. So this is going to be helpful in understanding like what is the progression of the disease as well. Now, when a patient is going to undergo various kinds of treatment, maybe say chemotherapy or even radiation or surgery, it is also going to have an impact on their nutritional status as well. What are the common symptoms to look out for if you are suspecting a prostate cancer? First of all, there would be trouble while urinating, there could be pain as well, or even the frequency of the urination can be increased. Next, there will be blood in the urine, which is generally observed. Now, these are the red flags which you need to keep in mind if you suspect that it could be some other medical condition. It is always advisable to get it timely checked from a urologist to understand and rule out certain medical conditions. Now, when a patient will undergo chemotherapy or a radiation, they also can experience several side effects as well. The key important thing is that we need to manage these side effects or symptoms with the help of a diet. Okay, now when a patient is undergoing chemotherapy, they could sometimes experience side effects such as weight loss or even mouth ulcers. There can be also loss of appetite as well, which is seen in these patients. And hence, it is very important to alter the diet during that time. They can also experience nausea or vomiting as well. Now, suppose if they're going to be experiencing nausea or vomiting, the first important thing is to give them small, frequent meals in the diet, preferably 5 to 6 meals in a day, in an interval of 3 hours. Ensure that the food is kept at room temperature and then given to them. Now, when a patient is experiencing nausea or vomiting, sometimes with the smell of the hot food itself, they will feel that, okay, I don't want to eat the food. But it is very important that they have to eat because they also need to ensure that their body gets strength as well. Okay, so what you need to do is that you need to give them the food which is cooked at a room temperature. Try giving them small sips of water throughout the day so that they shall be well hydrated. You need to time their meals best when the nauseatic medications have been given. Okay, now whenever they are hungry, give them a good meal or a big meal during that time so that their body will get the nutrition which is required. And if they are experiencing vomiting, then try and ensure to give them frequent fluids in the diet. You can also give them a concoction of ginger which is boiled in water. It is also going to play an important role in reducing the nauseated feeling as well. Now, because of the treatment, you can also experience mouth sores. We generally call it as mouth ulcers or oral mucositis. The severity will be depending upon patient to patient, and sometimes it could also happen that you do not feel to, even you can't swallow as well, or you can't chew the food. Whatever you eat, it is going to be irritating your mouth lining as well. Hence, it is very important to give again the food at room temperature Rather, give a bland, soft diet which is easily tolerable and will cause less of irritation to the inner mouth lining. If the patient is going to have difficulty in swallowing, give them more of a liquid diet. Now, when I say a liquid diet, the consistency can vary. It can be thick, even like maybe, for example, say a smoothie, or it can be as thin as an apple juice as well, which is free flowing and they will be easily able to swallow that. So the consistency has to be changed based on the individual. Now, during radiation, the patient may also experience a change in their bowel habits. It could either be an increased frequency to go for washroom, and they can also experience bloating and heaviness in the stomach or flatulence as well. So during this time, what happens is it is again important to modify their diet. You can give them ajwain water or jeera water as well, which also helps in reducing the flatulence or bloating, and it is also known to be good for digestion as well. Ensure that they have a good water intake throughout the day. You can also check with your oncologist that what is the fluid restriction. Now, also, since the patient is having prostate cancer, we also need to monitor the creatinine levels as well. So, if the creatinine levels are to go high, you again have to give them a potassium restricted, salt restricted diet. But again, that is highly individualized. Now, coming back to the bowel habits and the change in the gastric discomfort. So, when that happens, you also need to ensure to give them a soft diet so that it will be even soothing for the gut as well, and even the gut will get rest. Try to avoid spicy and also less oily food in their diet. All right. So now lactose intolerance can also occur in these patients, because what happens is that when they undergo a pelvic radiotherapy, there can be a reduction in the brush border enzymes, and it can contribute to again several bowel symptoms like abdominal cramping or diarrhea as well. So during this time we need to ensure to reduce the intake of milk, because milk is again a high residue which can cause irritation to the gastric lining as well. If they are not experiencing loose motions, you can surely incorporate alternative sources of milk like almond milk, soya milk, or even sesame milk as well. To conclude, yes, nutrition plays a very important role when a patient is having prostate cancer. The nutritional requirements will be are individualized and based on the current body weight of the patient as well. Thank you so much for watching my video. We at ZenOnco.io are here to navigate you through your cancer care journey. In case of assistance, you can surely reach out to our cancer coaches on the below mentioned contact number.